This medication is used to relieve mild to moderate pain from various causes such as headaches, menstrual periods, toothaches, backaches, osteoarthritis, and cold/flu symptoms. It can also be used to reduce fever. The recommended dosage for adults is 2 tablets every 4 to 6 hours as needed, with a maximum of 8 tablets in 24 hours. It's best to take this medication with food or milk to reduce the risk of stomach upset. Always follow the instructions on the label and consult with a healthcare professional if you have any concerns. To take this non-aspirin tablet, chewable, simply follow the directions on the product package. Make sure to read the dosing instructions carefully because different brands and forms of acetaminophen may have different amounts. It's important not to take more than the recommended dose. If you're giving this medication to a child, use a product specifically meant for children and use your child's weight to find the right dose. If you don't know your child's weight, you can use their age. For suspensions, be sure to shake the medication well before each dose. Measure the liquid medication with the provided dose measuring spoon/dropper/syringe to ensure the correct dose. Chewable tablets should be chewed thoroughly before swallowing. Do not crush or chew extended-release tablets, as this can release all of the drug at once and increase the risk of side effects. If using effervescent tablets, dissolve the dose in the recommended amount of water and then drink it. It's best to use pain medications at the first signs of pain. If you wait until the symptoms have worsened, the medication may not work as well. Do not take this medication for fever for more than 3 days unless directed by your doctor. For adults, do not take this product for pain for more than 10 days, 5 days in children, unless directed by your doctor. And if you think you may have a serious medical problem, get medical help right away. If you experience any unusual effects from taking this non-aspirin tablet, chewable, it's important to contact your doctor or pharmacist right away. However, this medication usually has no side effects, and many people using it do not experience any serious issues. In rare cases, a very serious allergic reaction could occur, so seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice anything else unusual, make sure to contact your healthcare provider. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. And if you're in Canada, you can report side effects to Health Canada at 1-866-234-2345. When taking non-aspirin chewable tablets, it's important to be aware of the risks associated with acetaminophen. Adults should not exceed 4,000 milligrams, 4 grams, of acetaminophen per day, and those with liver issues or children should take even less. Always consult with your doctor or pharmacist to determine a safe dosage. It's crucial to avoid taking other medications containing acetaminophen without consulting a healthcare professional first. Acetaminophen is a common ingredient in both over-the-counter and prescription drugs, such as pain relievers, fever reducers, and cold and cough medications. Be sure to check the labels of all your medications and ask your pharmacist if you're unsure. If you accidentally take too much acetaminophen, seek medical assistance immediately, even if you don't feel unwell. Symptoms of an overdose can include nausea, vomiting, loss of appetite, sweating, stomach pain, fatigue, yellowing of the skin and eyes, and dark urine. Regular alcohol consumption, particularly when combined with acetaminophen, can harm your liver. It's best to avoid alcohol while taking non-aspirin chewable tablets. Before taking non-aspirin chewable tablets, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a history of liver disease or regular alcohol use. This product may contain inactive ingredients that could cause allergic reactions, so it's best to discuss this with your pharmacist. If you have diabetes or phenylketonuria, you should use caution when taking chewable tablets, as they may contain sugar or aspartame. It's important to talk to your doctor or pharmacist if you need to limit or avoid these substances in your diet. If you're pregnant or breastfeeding, it's important to consult your doctor before using this medication. Always follow your doctor's advice when it comes to taking medications during pregnancy or while breastfeeding. When taking non-aspirin tablet, chewable, it's important to be aware of any potential drug interactions that could affect how your medications work. This includes the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are ketoconazole and levoketoconazole. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. It's important to ensure that lab personnel and all your doctors are aware that you are using this drug. If you or someone else has taken too much non-aspirin tablet and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 for immediate help. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. For Canadian residents, contact a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. Acetaminophen, found in non-aspirin chewable tablets, does not cause stomach and intestinal ulcers, which are common with NSAIDs like aspirin, ibuprofen, and naproxen. However, it also does not reduce swelling like NSAIDs do. It's important to consult with your doctor to determine which medication is the best option for you. Non-aspirin chewable tablets are commonly used to relieve minor aches and pains due to headache, muscle aches, backache, toothache, the common cold, and menstrual cramps. The recommended dosage for adults is 1 to 2 tablets every 4 hours, as needed, while the maximum dosage should not exceed 8 tablets in 24 hours. Always take it with a full glass of water and do not take more than directed. It's best to take this medication with food or milk to prevent stomach upset. Remember to follow the instructions on the label or as directed by your doctor for the best results. If you forget to take this medication on your regular schedule, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed one and take the next dose at the regular time. Don't take a double dose to make up for the missed one. When it comes to non-aspirin tablets, it's important to store them at room temperature, away from light and moisture. Be sure to keep them out of the bathroom and away from children and pets. If you need to dispose of the medication, do not flush it down the toilet or pour it into a drain unless instructed. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.